Hello friends, today we are going to discuss about attention deficit hyperactivity disorder, also called as ADHD. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. In this video, I'll be discussing about assessment of ADHD, treatment, and course and outcome of ADHD. ADHD was once considered only a childhood disorder, but now the literature clearly establishes that ADHD is a lifelong diagnosis, and many of the adults continue to have symptoms of ADHD. Children with ADHD do not just grow out of ADHD, they require intervention. And ADHD affects all dimensions of life. It may be academic, education, home front, at the family level, social level, and also with peers. They find it difficulty in paying attention, that is, inattentive type. Some of them will have hyperactive, impulsive type, and sometimes emotional dysregulation is the one where the least importance have been given. Let's look into the prevalence of ADHD. Various studies and meta-analysis across various nations have clearly indicated 5 to 7% of the children develop and suffer from ADHD. 2 to 2.5% of the adults continue to have ADHD symptoms. Let's look into the assessment of ADHD. Here, I'll be discussing about assessment of ADHD in children only. I'll be making a separate video on adult ADHD. Let's look into the assessment. First and the foremost, the gold standard assessment in ADHD is clinical assessment. What do you mean by that? It's very clear. ADHD cannot be just diagnosed by the use of certain instrument, maybe whatever the instrument it is. Here, the clinical observation, looking into the various aspects of child's family, social, environmental background, where are these symptoms presenting, at what frequency, at what dysfunctional level, all these consideration has to be taken to making diagnosis of ADHD. Hence, clinical assessment is the gold standard. So what has to be done? First and the foremost is comprehensive history taking, interviewing family members, parents, sibs, relatives, friends, and if required, even the teacher's reports, talking to the teacher over the telemedicine or maybe on telephone, interviewing of the teacher, looking at the past history, treatment history of the past, personal history of the child, and also observing the child. ADHD cannot be just diagnosed in single setting, especially in mild to moderate case, especially with regard to inattentive type, you may require multiple setting. Severe to moderate hyperactive and impulsive type of patients can be easily diagnosed in single setting. In certain situation, especially there is a poor informant, the father or mother, or the child being silent in certain situation, especially in the hospital, may find it difficult to make a diagnosis. Hence, invariably some patients require multiple settings, unless child has severe symptoms. What are the other structured assessment of ADHD? That means, here you will be using certain instruments, such as certain scales. The commonest scale which is used is Connors Parents and Teacher Rating Scales of ADHD, Berkeley School Situation Questionnaire, Comprehensive Teacher Rating Scale, ADHD Symptom Checklist 4, Behavior Assessment System for the Children, Disruptive Behavior Disorder Rating Scale, Child Behavior Checklist, commonly known as CBCL, Vanderbilt ADHD Teacher and Parent Rating Scale. So these are the structured assessment of ADHD has been utilized. But however, the combination of clinical assessment and structured assessment is the gold standard. So please remember, ADHD cannot be just diagnosed using rating scales, or just using neuropsychological test, or just by doing neuroimaging. Clinical assessment is mandatory. ADHD should be diagnosed using multi-pronged approach, in certain cases multiple setting, involving history taking, collating information from multiple resources, Parents, teachers, family members, relatives, siblings, clinical examination, observation of the child. If required, the child may have to be admitted and observed, mental status examination. As I mentioned, in a single setting, moderate to severe ADHD with hyperkinetic or impulsive type can be easily diagnosed, as inattentive type requires multiple setting. Let's look into the treatment of ADHD. The treatment of ADHD involves, first and the foremost, parental intervention. As soon as you diagnose a child with ADHD, you need to sit with the parents and discuss with them, because the parents are the one who are going to take a decision what type of treatment, how long the treatment will continue, whether the treatment will be given or not. All those will be decided by the parents. Unless you engage the parents, you're not going to do any benefit to the child. Second is deciding about the medication, psychotherapy, combination of above, and finally, digital health intervention. That is, technological advancement has been a boon for the treatment of ADHD. Let's look into the parental intervention. Why this is required? As soon as the parents come to know that their child is suffering from a psychiatric diagnosis or a disorder, they will be shattered into pieces. They will have guilt, they will start blaming each other, parental conflict will start, and invariably the child will be neglected. Many a time, parents become overprotective. They refuse to accept the diagnosis. They will be in denial. They will refuse to take medication. And when you say the medication has to be given for many years, they outrightly reject. They will go on doctor shopping. They will end up in various complementary alternative medicine treatment also. Many a time, they don't give treatment at all. They will start beating the child. And invariably, the guilt, along with blaming each other, is a deadly cocktail towards the child. Further, we need to educate the parents with regard to ADHD, the need for treatment. If they don't give treatment, what are the course and outcome of the child has to be clearly discussed with the parents. And also, we need to educate about the medication. What are the benefits and side effects of medication? And if you don't give medication, what will happen needs to be discussed. Further, along with the medication or even psychotherapy, parenting of ADHD child is a big challenge. Hence, handholding and mentoring of the parents is essential for lifetime. And my dear friends, that is the reason parental intervention, whether you give medication or cognitive behavioral therapy or any other intervention, please engage both the parents. Without engaging the parents, you are not going to go anywhere in the treatment of ADHD. In many a time, countries like India, where joint family system is there, please do engage the other significant family members, maybe grandparents, maybe uncle, aunt, should be involved in the treatment process of ADHD. Let's look into the second step, that is medication. There are two important medications classes are available in ADHD. The first class is the primary medication, that is stimulant. The stimulants such as methylphenidate, dexamethylphenidate, amphetamine, methamphetamine, lisdexamfetamine are the commonest medication which have been approved and prescribed in children. Let's look into the dosage. If you are giving methylphenidate, the dosage should be somewhere around 40 to 60 mg per day. Dexmethylphenidate is 20 to 40 mg per day. Amphetamine is 20 to 40 mg per day. Methamphetamine is 20 to 25 mg. And lisdexamfetamine is 70 mg per day. If you look at the secondary one, are called as non-stimulant ADHD medication. The commonest is atomoxetine, the dosage of 60 to 100 mg per day, guanosine 1 to 4 mg per day, clonidine 0.1 to 0.4 mg per day. Divided doses has to be given, that is usually twice a day. So my dear friends, these are the medications which have been approved for the treatment of ADHD. Let's discuss about the mechanism of action of both stimulant and non-stimulant in the treatment of ADHD. Most of the ADHD medication are thought to act through the primary action of catecholamine pathways. At the synaptic level, these drugs, both stimulant and non-stimulant, seems to act as a catecholamine agonist. They increase the availability of dopamine and norepinephrine. That is, by blocking the uptake is one of the primary way of increasing these neurohormones at the synaptic level. Recent PET imaging studies indicated that transporter density increases and becomes high after chronic treatment with stimulant. Hence, there is a kind of stability in the children of ADHD when you treat with stimulants over a period of time. Let's look into the each one of the class of drugs, how they act in ADHD. With regard to methylphenidate and amphetamine, both these drugs inhibit dopamine and norepinephrine transporters. That means they inhibit them, so they make the availability of dopamine and norepinephrine in increasing quantity. Not only that, they also work by reuptake inhibitor, increasing the neurotransmitters primarily in the striatum and prefrontal cortex. Hence, my dear friends, methylphenidate and amphetamine play a crucial role and considered to be the first line of treatment in ADHD. However, one need to remember this can cause dependence in only certain class of patients. Moving to atomoxetine. Atomoxetine inhibits norepinephrine transporter 1 and also prevents the reuptake of norepinephrine in all regions of the brain and of dopamine specifically in the prefrontal cortex. So atomoxetine also play a similar role. Moving to medication like guanosine and clonidine stimulates alpha-2 non-adrenaline receptor and increases non-adrenergic tone in the prefrontal cortex in the central nervous system. Similarly, the buprenorphine is converted into two main metabolites, that is hydroxybupropion and thiohydrobupropion, that are potent non-epinephrine enhancer by transporter inhibition. Moving to tricyclic antidepressants like amitriptyline and imipramine primarily acts by blockade of serotonin and norepinephrine transporter, which enhances the neurotransmission. Although these medications may have a different mechanism of action with regard to increasing the catecholamine and agonist of catecholamine, the ultimate effect appears to be similar in nature, since they all appear to increase the availability of dopamine and or non-adrenaline. This in turn increase of dopamine and non-adrenaline modulates the neurotransmission of wide range of brain circuits, primarily GABAergic and glutamatergic, that controls a range of cognitive function including executive function, reward, memory, and timing and motivation. So my dear friend, this is how stimulants and non-stimulants act in ADHD. ADHD medication may also promote long-term alteration in the brain through the regulation of genes and protein, that is neuronal plasticity, including synaptic plasticity, dendritic plasticity, receptor plasticity, and neurochemical, that is neurohormonal plasticity, my dear friend. If you look at the genetic expression and also the gene involvement in various ADHD, and also when we give medication, the presence and expression of certain genes indicates involvement of neuronal plasticity when you give medication, and also cognitive behavioral therapy has been found to be in preliminary studies. Now, let's discuss the first line of medication. Network meta-analysis of 190 RCTs was done. This network meta-analysis clearly indicated the psychostimulants, that is methylphenidate, amphetamine, are the first line of treatment and found to be very effective in the management of ADHD. Similarly, a second network meta-analysis of pharmacological treatment involving 73 studies involving 15,025 participants clearly indicated lisdexamfetamine to be found to be very effective and the first drug to be chosen even in the treatment of stimulants. Atomoxetine has been indicated especially whenever the psychostimulants are not well tolerated, comorbid conditions like psychosis, bipolar disorder, and substance use disorder is there, atomoxetine should be chosen. Hence, in adult ADHD, atomoxetine has been considered invariably. However, Now, the literature is clearly indicating if you are giving stimulants in the childhood, it is worth continuing stimulants even in the adult. If we look at the clonidine and guanosine, has been found to be effective in meta-analysis with moderate size effect similar to atomoxetine. Newer drugs have been tried in the treatment of ADHD, such as dopamine and norepinephrine enhancing drugs, the drugs which are HLD 200, dasotrelin, centafedine, valoxazine, and mezinidol, glutamate agonist, fosaracetam, GABA modulator, metodoxin, antipsychotic, molindone, atypical antidepressants like ortoxetine have been considered in ADHD. However, these are still a research molecule and requires various RCTs and long-term treatment to see the effect of ADHD in the children. Now let's understand how to choose the medication. The medications are chosen based upon three important factors. One is patient age, ADHD severity, and comorbidity. If the child is preschool, then you need to consider cognitive behavioral therapy and also parental intervention, especially if the child is mild to moderate. Even if the child is very severe, you may consider stimulant after discussing with the parents. And please remember, more the severe is the ADHD, medication is indicated. If there are comorbidities such as tic disorder, non-stimulant should be chosen. Disruptive disorder, again, you need to choose stimulants here. Substance use disorder indicates you need to give non-stimulant medication. Mood and psychotic disorder involves giving, again, antipsychotic sometimes and also giving non-stimulant medication. So, my dear friends, please remember this. It is not just giving stimulant. You have to be very careful depending upon the age of the child, severity of the symptom, how much it is dysfunctional, and presence of comorbidity. As I mentioned in the previous video, comorbidity is there in 70% of the children. Hence, you need to think of comorbidity, how you are going to address the comorbidity, and also give medication for ADHD. Hence, further, some other important factors you need to consider before prescribing medication. The choice of treatment by the family members, that is parents, and also the child. Will they choose psychological treatment or CBT or medication or the combination of above? Further, the patient preference and attitude and adherence to the medication by the patient and the parents also play a crucial role. School going, then the symptom relief is very essential when they are focusing on the studies. Should we consider CBT or medication? And finally, affordability and availability of medication in the society, and also whether they should go to psychiatrist only, availability of psychiatrist, and further availability of psychologist for cognitive behavioral therapy play a crucial role in dictating what kind of treatment can be afforded to ADHD patient and family members. Let's look into the response and duration of treatment. Before you start any medication or any therapy, you need to document the activity of the child from morning to till the child goes to sleep. And also you need to see how the child sleep pattern is. This need to be documented over a period of 1 to 2 weeks to know when the child is active, when the child is hyperactive, when the child need to focus for studies, and at the same time focus in social interaction. Based upon that, you need to ration the medication. That means you need to tailor the treatment based upon the need of the child. Intake of medication should be very clearly determined when the child goes for studies. Then only you need to give the medication. Further, once you start medication, you need to educate the family members and also make sure there is supervised medication for the children. And you need to wait at least for 6 to 8 weeks before you increase the medication or change over to other treatment. Medication should be given for longer duration for the benefit of the child because the child is growing. At the same time, academic growth is very essential. Social growth, peer pressure, Having a good relationship with the friends, family members, and at the school play a crucial role in the overall development of the child. Medication holiday can be considered. This is a old concept now. Now, many of the researchers and physicians advocate against the drug holiday because drug holiday is not going to help the child. Further, if there is no response, please do consider changing over to another medication rather than add on. Moderate to severe ADHD requires combination of both medication and psychological treatment. Let's look into the psychosocial treatment. Psychosocial treatment can be divided into three important domains. One is behavioral management intervention, that is, parental training, classroom intervention, and peer based intervention. These are chosen especially if the child is preschool. And here, engaging the child for treatment, especially a small child for treatment, is very difficult. Hence, training the parents, school teachers, and peers become very essential. Training interventions, that is cognitive retraining or cognitive training, neurofeedback, coaching, and cognitive behavioral therapy. Finally, psychological treatment, physiological treatment, that is physical activity. So these are the three important which has been considered across the world with regard to ADHD. Let's look into the three important components: behavioral intervention, cognitive intervention, and cognitive behavioral therapy intervention. Behavioral intervention includes parental training with regard to how the child should be reinforced, consistent pattern of reinforcement and punishment, at the same time, how they need to react and to modulate the child's emotion. Child focused training, social skills training, training of planning and organizational skills, self management techniques, mindfulness, and school based therapy should be considered in behavioral intervention. In cognitive intervention can be utilized by using pen paper method, computer method, tablet, or even phone based aided gaming and interventions are available nowadays. And of course, cognitive behavioral therapy do play a crucial role in treatment of ADHD. And this requires a trained clinical psychologist, especially the child psychologist, who are well trained in managing ADHD, need to be involved in the treatment of ADHD, especially in children and adolescents, my dear friends. Here, you will be involving using the cognitive behavioral therapy principle in the treatment of ADHD. Now, if you look at the psychosocial intervention, especially the involvement of preschool children, parental intervention, school based intervention, and peer based intervention, which I mentioned, need to be considered when you see a child as young as 6-year-old suffering from ADHD. If you look at the American Academy of Pediatrics in 2019, advocated an important guideline. In the preschool age group between 4 to 5 years, the first line of treatment is evidence-based parent training in behavioral management, that is PTBM, and also behavioral classroom intervention, and methylphenidate may be considered if the child has severe ADHD or if there is no improvement in the symptom, especially in the elementary and school aged children. Here 6 to 11 years is the age group. Medication approved by FDA need to be considered along with parent training in behavioral management, that is PTBM, and behavior classroom training or intervention, preferably both can be considered. Adolescent between 12 to 18 years, FDA approved medication, and here the cognitive behavioral therapy comes into picture because after the age of 12 years, the cognitions are well developed, and if the child is intelligent, involving in cognitive behavioral therapy plus medication play an important role. This is American Academy of Pediatrics guideline. If you look at this PTBM approach, that is positive parenting training program, that is called as triple P, parent-child interaction therapy, incredible years, Cassadin method, New Forest parent training program has been considered in the treatment of ADHD. This requires parents being actively involved in the treatment program. It is not just the psychologist, psychiatrist, or the social worker is involving the child. Parents' participation is very, very essential. Parents' involvement in medication, giving medication, getting educated about ADHD, how to modulate the child's emotion, all play a very important role in the management of ADHD. If you look into CBT in ADHD, studies that involved adolescents receiving CBT found that parents had improved reading of ADHD, but however, the benefit of with regard to ADHD as a functional impairment continue to occur in spite of CBT. Cognitive training helps in improving working memory and involving computerized training can be administered with or without clinician. But however, again, ADHD related functional improvement was minimal. Although by giving CBT, here there are some symptoms reduction occurred, but functional impairment continued to occur in spite of giving CBT. Invariably, CBT is given over a period of 3 to 6 months, sometimes 1 to 2 years. Here we are talking about a child who is going to take medication or the having ADHD symptoms for lifelong. That means you need to engage the child for lifelong or else give medication or combination of both play a important role. And there are various coaching and mentoring programs have been brought in for the management of ADHD. First and the foremost, coaching or mentoring program was given by Field and Hoffman's model. This model was given in 1994 and it is called as self-determination model. What is the self-determination? Ability to define and achieve goals grounded in knowing and valuing oneself is self-determination. Here, the child and parents will be involved in coaching and mentoring, especially involving adolescent. Here, you're going to talk about know yourself and value yourself. What do you mean by know yourself? Increasing the awareness of one's own preferences, needs, strengths, and weaknesses. Value yourself. Identifying strengths, supporting the self acceptance of disability, and motivation for self advocacy and improvement is value yourself. Further, plan. You need to plan for learning various important skills to beat the ADHD. Act. Persistence, negotiation, conflict resolution around the risk taking and barriers that may result in treatment of ADHD. And finally, experience outcome and learn. Learning skills, evaluate the progress of change and expected outcome. And finally, recognition and celebration of success play an important role in coaching and mentoring. Although these can be advocated and given by non professionals, but they need to undergo training in this administration of coaching or mentoring program in ADHD in children. One of the important landmark study done by National Institute of Mental Health collaborative considered as multimodal treatment study of children with ADHD, in simple word called as MTA study. Here in multimodal therapy, where medication plus intensive behavioral therapy was not significantly superior to medication alone. Medication is stimulant. However, one more meta-analysis which was reported, combination of medication and cognitive behavioral therapy have been found to be more effective than medication alone. That means there is some conflicting evidence. And here in MTA study, a very good study which talked about providing psychostimulants alone is enough in ADHD. Some study mentioned combination is better. The evidence for psychological therapy is conflicting, especially in younger children. However, in older children, it has been found to be helpful in various other domains, but not in the functional improvement in ADHD. Evidence of behavioral intervention is difficult to integrate and summarize for simple reason: heterogeneity of the studies. What is the definition of ADHD? How many symptoms is required? Duration of symptoms? What are the scales used? What are the outcome measures taken? What are the cognitive level of ADHD? What are the comorbidities which were taken into the consideration of study? Whether it was blind or whether it is RCT, all these considering, hence it is difficult to come up with a conclusion what is the best psychological treatment for ADHD. Evidence so far available suggests that cognitive training has mild effect on the core ADHD symptoms. Studies suggest there are these psychosocial symptoms or treatment are effective in child-parent relationship, social skill improvement, conduct symptoms, and oppositional behavioral symptoms. Functional improvement is very poor in psychological treatment as for the available literature. Some studies which have a poor methodological issues do also report improvement in ADHD functional improvement. But at this point of time, my dear friends, we require long-term studies, long-term intervention of CBT, long-term intervention of behavioral therapy, and of course, long-term stimulants if we give. What happens to the child and when it becomes adolescent and adult need to be evaluated in a systematic study. Let's look into the computer-based or digital intervention of ADHD. As IT technology is coming forefront, some of the software and also hardware has been introduced in the management of ADHD. On 15 June 2021, Food and Drug Administration, that is FDA of US, approved a game-based digital intervention called as EndeavorX. This is approved for the treatment of pediatric age group between 8 to 12 years for inattentive type of ADHD. It is not useful for impulsive and hyperactive type of ADHD. This has been found to be very useful and a novel treatment, especially acceptability very high in children, good compliance, mild side effect, but however needs study and funding for longer duration. Currently, please remember it is approved only in 8 to 12 years of old and inattentive type of ADHD, not in hyperactive type. Effect of video games have been found to be conflicting. If the video game is used in moderate, then it is found to be very effective in the improvement of cognition, especially reward processing, improved working memory, processing speed, problem solving, and attention. Video game has been found to be effective in cognitive, motivational, emotional, and social domain whenever they play in group. But again, it has to be used in moderation. If it is used and abused, then there is high possibility this can become a double-edged sword, especially child becoming addicted to the video games, that is, video games dependence in children. Hence, there is a high need for studying impact of these video games on ADHD. Besides game-based digital therapeutic advice, other digital health intervention like smartphone apps, wearable technologies, and potential treatment of ADHD need to be considered, and there are various tests are ongoing at this point of time. At the same time, there are various alternative methods of treatment, that is complementary alternative treatments are also available, such as yoga, mindfulness, tai chi, exercise, diet therapy, sports and games, RTMS, TDCS, and hypnotherapy. A systematic review was done in yoga and it has found to be helpful in ADHD. However, there is a systematic RCT and meta-analysis has to be done to see whether yoga is found to be very effective and improves functionally when ADHD symptoms are treated. Similarly, the Chinese traditional Tai Chi has been found to be very effective in ADHD. And this Tai Chi includes such as Chinese herbal medicine, acupuncture, Yoshohan, that is diet therapy, Chinese medical massage, and Tai Chi Chuan has been considered for the treatment of ADHD. At this point of time, there are some evidences indicating Tai Chi be very helpful. Here in Tai Chi, the slow movements of the body plays a crucial role in the treatment of ADHD. But however, at this point of time, rigorous RCT is required in advocating Tai Chi is the treatment of ADHD. With all these, now let's understand what is the course and outcome of ADHD. Follow-up studies have clearly reported and divergent results have been found. They have reported up to 70% of the patients with ADHD in adolescent continue to have symptoms even in adulthood. Few studies have reported 45 to 55% of the adult continue to have ADHD symptoms. In overall, 40 to 70% of the ADHD continue to have their symptoms in adulthood. Meta-analysis indicated that inattention is more strongly associated with academic impairment, low self-esteem, negative occupational outcome, lower overall adaptive functioning. And these are the types of inattention continue to have their symptoms even in adulthood. Hyperactive and impulsive symptoms are associated with peer rejection, aggressive, risk-taking behavior, accidental injury. And these patterns are found to be slowly mellowing over a period of time, especially with regard to hyperactivity in the adulthood. Inattention continues to be there, emotional dysregulation continues to be there in adulthood. models why some of the ADHD mellow down in adulthood. There are various models have been proposed. As I mentioned, only 30 to 40% remit. 70% continue to have, but they do not have hyperactivity or impulsivity. And these, even if their hyperactivity and impulsivity is there, it will be seen in only in certain domain. Why is this? Why there is improvement in ADHD, especially in adult? There is not full-blown ADHD not seen in adulthood. The reason being, remission at adult age may be reduced to the normalization of the brain functioning through maturation. That means brain maturation occurs here. Neuronal, maybe myelin sheath, maybe maturation of neuron, various other components, development of the neuronal, especially prefrontal cortex, which occurs up to the age of 25, play a crucial role in decreasing hyperactivity and impulsivity. Remission through recruitment of compensatory mechanisms in the brain, what we call it as neuronal plasticity, also play a role in adulthood. Brain function anomalies show lifelong persistence even though behavioral dysfunction may have remitted. That means cognitive dysfunction continues to be there in spite of behavioral symptoms have remitted, but cognitive symptoms continue to be there. To conclude, my dear friends, ADHD is a lifetime diagnosis. 70% of the children and adolescents continue to have symptoms even in adulthood. Most of the time, it is undiagnosed and untreated ADHD both in children and adult. ADHD can destroy child's future, and these children may become burden to the family and also to the society. Hence, early identification and treatment is the only way to go forward. Treatment of ADHD needs to be tailored based upon the child's activity, schooling timing, and the patient's and parents' preference play a crucial role. At this point of time, medication are the first line of treatment, or combination of medication and therapies play a crucial role. However, availability of these medication, availability of psychiatrist, availability of cognitive behavioral therapy and psychologist also play a role in the choice of treatment. Please remember, involving parents, involving teachers, schools, policymakers, peer-based therapies play a crucial role in modeling, maintaining, improvement in ADHD children. Thank you very much for your valuable time. Stay safe.